Madam, we are discussing on a motion under 193 brought by Anurag Thakur on sustainable development goals, health and welfare for all. You've already heard two speakers. Before I begin, I must thank the Honorable Speaker that she has been pursuing this issue of sustainable development goals with persistence. Not only in Delhi, she had a Commonwealth Women MPs meeting at Jaipur in August 2016, where this was highlighted. Then again, in Indore, she had an Asian Speaker Summit in this year, where she highlighted the Sustainable Development Goals. So here, through the intervention of the Speaker, we have made progress. Madam, you know this issue of Sustainable Development Goal, this came up during the presidency of Gro Harlem Brundtland, the Norwegian Prime Minister, who provided a definition of sustainable development that was used for the next 25 years. This was in 1925. This intergenerational concept of sustainable development was adopted at the 1992 UN Conference on Environment and Development at Rio in 1992. The definition of sustainable development has evolved to capture a more holistic approach, linking the three dimensions of sustainable development: economic development, social inclusion, and environmental sustainability. This three-part vision of sustainable development was emphasized at the 2012 Rio Plus 20 conference. So Rio was in 1992, Rio Plus 20 was in 2012. Now, Madam, I need not state what are the 17 goals for sustainable development. There are no poverty, zero hunger, 3, which we will discuss today: good health and well-being, quality education, gender equality, clean water and sanitation, affordable and clean energy, decent work and economic growth, industry and infrastructure, reduce inequalities, etc., etc. You will notice that all these 17 goals are interlinked. For instance, good health and well-being is linked to clean water and sanitation. Even gender equality is linked to this. Unless women get equal attention in health matters, how will maternal health improve? And all this is linked again to economic growth. So the point is to have a holistic view on the whole matter, and that is why it is necessary to discuss the goals at length. Now, let us see about how progress has been made in this matter. In child health, throughout the world, 17,000 fewer children die each day than in 1990, but more than 6 million children still die before their 5th birthday every year. So 60 lakhs children are dying before their 5th birthday. Maternal health, maternal mortality has fallen by almost 50% since 1990. But in the Eastern Asia, North Africa and Southern Asia, maternal mortality has declined by about 2/3. But proportion of mothers who still do not survive childbirth compared to those who do is still 14 times higher in underdeveloped regions than in developed regions. Only half of women, we are talking of gender equality, Only half of women in developing regions receive the recommended amount of health care. Lastly, maternal mortality rate, MMR, from 437 per lakh live births in 1991 came down to 167 in 2009. In 2009, 72% deliveries were institutional. So there has been a big progress. And next, the big challenge towards health is HIV AIDS. By 2014, there were 13.6 million people accessing antiretroviral therapy, an increase from 8 lakhs in 2003. India has made significant strides in reducing the prevalence of HIV and AIDS across various high-risk categories. Adult prevalence has come down from 0.45% to 0.27% in 2011. So we have made progress in bringing down the number of those affected by HIV AIDS.
The number of new cases are also 28.
Madam, I'll give you the figure. At the new HIV infections in 2013 were estimated at 2.1 million, which was 38% lower than in 2001. So newer cases are also coming down with antiretroviral therapy. And at the end of 2013, 240,000 children in India were infected with HIV through their parents. Now, having said that, let us judge what are the big goals for 2030 for India. One, by 2030 for India and the world. By 2030, reduce global maternal mortality rate to less than 70 per lakh childbirth. By 2030, end preventable deaths of newborns and children under 5 years of age. By 2030, end the epidemics of AIDS, tuberculosis, malaria, and neglected tropical diseases, and combat hepatitis, waterborne diseases, etc. By 2030, reduce 1/3 premature mortality from non-communicable diseases. 5, strengthen the prevention and treatment of substance abuse, including narcotic drug abuse and alcohol. By 2030, that is up to which our sustainable development goal is, ensure universal access to sexual and reproductive healthcare services, including for family planning, information and education. Achieve universal health coverage, but it kills your liver slowly also. Achieve universal health coverage, including financial risk process protection. Strengthen the implementation of World Health Organization Framework Convention on Tobacco Control in all countries, all by 2030. Support the research and development of vaccines and medicines for the communicable and non-communicable diseases. Substantially increase health financing. Strengthen the capacity of all countries, in particular developing countries, for early warning, risk reduction and management of national and global health risks. So, Madam, I have more or less formulated the big problems today. Now, healthcare is not about doctors only. I know, Madam, you are a reputed pediatrician yourself and a dedicated person who still does a lot of pro bono work for poor children. We admire you for that. But As has been stated earlier, doctors are considered demigods by the patients and their relatives, but they don't act as demigods. In India, especially in my state of West Bengal, 90% of the people are still dependent on government hospitals and public health care. The big hospitals, nursing homes, the Apollos, the Fortis, the Maxes, they've all come on in big cities. And they are money-punching machines. They are not giving people treatment. They are sucking money out of the system. Madam, you know that in West Bengal the situation became so bad. There were several attacks on hospitals after patients died, and huge bills were imposed on them. Our West Bengal government enacted a Clinical Establishment Act in which there will be a commission to go into the bills raised by the hospitals. I think it's very essential for the government. I asked Nadda ji also, Delhi is the center of the big fish of the medical industry. It's time that some control be brought on them. Still, in Delhi, people come from all over India. Where? To the AIMS, to the Safdarjung Hospital. People, 90%, you see people lining up in AIMS from 2 o'clock in the night just to get a ticket. Because most people can't afford these big hospitals. They are only related if you say that you've got health insurance, cashless, then your bill is raised. So this is the condition of the hospitals today. Madam, that's why I feel there should be some standard practices prescribed, that in which condition what investigations can be done, whether patient should be sent into ventilator without any reasons, whether patient should be sent to ICU, and the standard protocol should be devised, should be finalized to control this. Madam, you know, in this house we have discussed how government has controlled the price of stents, which actually costing 40,000 rupees were being charged for 1.5 lakhs to 2 lakhs rupees. Government has taken some steps to control that. You know the price of drugs, because of WTO regulations, now the price of drugs had gone up very much. We are having to pay the patent for the foreign drugs, and they are abnormally costly. The government has a drug prices control order. I want that implemented strictly so that drugs, especially manufactured by multinationals, their prices are suitably brought down.
Now we have many good pharmaceuticals in our country.
We have very good. We have Sun Pharma. We have Dr. Reddy's laboratories. There has been, I don't know about Narendra Modi, but there has been an effort by the government to bring down drug prices, which I appreciate. Janaushadhi.
That also in our country.
No, I'll tell you, Madam, you are from West Bengal.
Yes.
You know the signal effort West Bengal government has done in the field of medical treatment.
Fair price.
Altogether 100 fair price medicine shops have been opened in West Bengal, where generic medicines are being distributed at 66% lower cost.
Maybe up to 70% in some
Up to
cases.
70%. You're very right. Madam, you also know that in West Bengal, in the government hospitals, All treatment is free, including kidney renal transplantation, including cardiovascular surgery and open heart surgery. The thing is, here in this house, while pursuing sustainable development goals, let me condemn all attacks on doctors, anywhere. Doctors are human beings. They are ones who save us. They may make a mistake, they're humans, but I do not believe that any doctor would let a patient die willingly. I do not believe that. So what happened in Maharashtra, in Dhule, an orthopedic surgeon was beaten up. He is fighting for his life. I wish for his quick recovery. In Bengal also, whenever such attacks have happened, our Chief Minister has taken the strongest possible action. We are ready to pull up doctors. We are ready to punish doctors through the legal means, not by this type of attacks. Lastly, I will end by your father, Dr. Gopal Das Nag, was also a high-class GP. And we are forgetting that concept of GP or the family doctor. Madam, nowadays there are only specialists and super specialists. There are no family doctors who advise a person on his health status. I think we need such people. In my childhood, I once went to see Dr. B.C. Roy for an ailment that I had with my father. You know what he prescribed me? He said, take a green coconut in the morning every day. For 1 month, you'll be cured. And I was cured. Doctors those days were not greedy for prescribing costly medicines. Doctors like Dr. Vidhan Chandra Roy and your father also, they prescribe simple medicines. They prescribe mixtures. Now mixtures are altogether forgotten. They prescribe ways in which people could recover quickly without spending too much money. We need specialists and super specialists, but not every disease needs super specialists. This is number one. Number two, you know there is an adage called prevention is better than cure. It is necessary to educate people on health habits. Like there was, when I was in the Ministry of Urban Development, we started a competition called hand washing competition. All over just one simple thing, that wash your hands before you eat may prevent many diseases. Like that, though I have differences with the ruling party, Swachh Bharat Abhijan, that is preventing open defecation, is one of the main sources of preventing diseases which are caused like hookworm and other diseases which are spread. So we must pursue clean habits. And lastly, ma'am, I want to say one thing, that women are neglected. You are a woman yourself. 65% of women in India suffer from anemia. Why doesn't the government arrange to give them iron tablets like Fetol free of cost? That is something, madam, most essential. Our women are all anemic. And we have recently passed the mental health bill. It was a debate in which you participated, madam. Lastly, I say that, madam, that day, the health minister, while replying, said that he was not in favor of psychotherapists. I do not think that in villages, we find in every mohalla, there are some mad people. There are people with mental problems. What we need is to train the ASHA workers in curing mental health, in meeting mental health challenges. We need people with a healthy body and a healthy mind. Let it be our sustainable development goal to really bring in, usher in.
Saugata, how many works they will do? They are already overburdened.
ASHA workers, give them more work, give them more money. You know, madam, in West Bengal, all ASHA workers have been given 500 rupee raise by the state government. Let the center give us more money,
Yes.
they will work more.
Yes.
And we are prepared.
Yes.
So give them some responsibility with regard to make the drugs cheap, make the hospitals approachable, and not butcher houses where poor patients' families are murdered. Let us march towards a disease-free, healthy, physically and mentally India. With these words, ma'am, I thank you for giving me the time.